for joining us here at the Breast Cancer Wellness Summit. Our next guest truly epitomizes an integrative approach to healing. Dr. Thrasher is a physical therapist, a naturopathic doctor, and an acupuncturist. She truly understands how to connect the dots and restore balance. She uses her knowledge and experience in her various disciplines in order to support healing in the body system. Dr. Thrasher, thank you so much for joining us here at the Breast Cancer Wellness Summit. Your profession as an acupuncturist, physical therapist, and naturopathic physician, the culmination of all of these practices have just made you an alluring member of the panel here. And I would just like to know how you came to navigate these various professions. And then lastly, I'd just like to know how you incorporate these practices in order to serve the cancer and breast cancer community.
I thank you for having me here. I came to PT from computers, believe it or not. I have a bachelor's degree in math computer science from Oakwood University in Huntsville, Alabama. I started out in computers as a computer programmer. Didn't like that. Joined the Air Force in computers. Worked at the Pentagon. My first about 5 years in the Air Force. From there, I basically talked with one of my friends who's an optometrist right now in Fort Worth and just told her what I wanted to do. Got kind of dissatisfied with the job. Some things happened, didn't turn out really well. I just told her I just want to help people when they get hurt to get better. That's it. That's all I want to do. She said, "Oh, you want to do physical therapy?" Didn't know what that was. Didn't have an internet then to go Google it, so I had to go to the library, got the big occupational handbook, looked it up, read it, still didn't understand it, but I was like, this is what I want to do. If that's what they do, okay, fine. Decided to apply to PT school, physical therapy school. And one of the schools that I applied to and eventually got into was the University of Alabama at Birmingham. And one of their requirements before being accepted was to do 150 hours of volunteer work. So I did that at the National Rehab Hospital, which was basically probably about 10 minutes from the Pentagon. I started out in acute care, which was basically like being in the hospital on the ward. Did not like that. One day I'm walking around, go across the skyway, and I walk into a room, standing in the threshold, and felt like I had died and gone to heaven. I was like, this is why I was put on this earth. And the only thing in this room was a bunch of machines. And then there was a black physical therapist there as well. And I just told him what I was doing, what I wanted to do. And he was like, well, I'm sorry, we're getting ready to close up. And my heart just sank. And I was like, what? He said, but we're moving across into the other building. I was like, do you need volunteers? He said, yes. And so I volunteered there. So I would leave work every day at 3:00, be over at the National Rehab Hospital by 3:15, 3:20, and I would stay there until 7:00. And so that's my little journey into PT. When I was in school, I always knew that I wanted to return to the Air Force. So once I graduated, that's what I did. I graduated on the 21st of December in 1991. And by the 25th of December that year, I had already been sworn in, was ready to go. Got started in the Air Force again in February of 92 because I had to do some classwork first. Did that and just loved it. The pathway into naturopathic medicine from physical therapy came with one of my other friends, Gina. She wanted to go to naturopathic medical school. We got into a lot of the holistic nutrition, enzyme therapy, all these kinds of things prior to that. So I was just following her from class to class to class. That's literally what I was doing. I had no interest. I was just like, I don't even know what she's doing. I'm just doing it with her. She got to talking about naturopathic medicine, got to talking about medical school, and I'm thinking to myself, oh, I do not want to go back to school. I'm in the Air Force. I'm a lieutenant colonel. I have climbed up the ladder. I have one more rung that I want to do before I retire, and that's to make full colonel. That didn't come to fruition. God had other plans. She ended up she's in ministerial training right now, and she's training to be a minister in the church. And I ended up going off to medical school by myself. I don't know if you've read the Bible, talking about a desert experience. That was mine. Because Arizona is the desert. I had no support system. I was away from everything and everybody that I knew. And it was just like, wow. And for me, that's probably the hardest thing that I've ever done. Most rewarding at the same time, but also the hardest. And so while in naturopathic medical school, the path to acupuncture was one of the modalities that we got trained in naturopathic medical school. But it was only a modality. And that's the way it was treated until I found out that I'm like, this is a whole system of medicine by itself. It has exercise and nutrition and cupping and moxa. You got the acupuncture, which most people know about. You have Tuina, which is the Chinese massage. You have Qigong and Tai Chi. So it's a whole medicine all on its own. And after I graduated from naturopathic medical school, took a year off because I was just really just tired and completely stressed out. I took a year off, and then I started at the acupuncture school there in Phoenix and finished there. They accepted the first 2 years of coursework from the naturopathic medical school, and then I had 2 years left. And so we did that, and that's the short version of the journey from one to the other.
Now, how do you integrate all of these skills, talent, knowledge from these different areas in order to maybe work with someone that is a breast cancer survivor?
Like you, when I first looked at all three of these, I saw them as separate entities, standalone by themselves, and I didn't see the crossover. And I was trying to figure out, how am I going to do this? And what are you going to tell people when they ask you what you do? It's like, okay, I put it on a whiteboard and I wrote down everything that occurred in each one of those specialties. And when I looked at it, I saw the pattern of they're all pretty much the same. They do an interview, they do an intake, they do a physical exam, they come up with a treatment plan. The difference is in the modality that you use. In acupuncture, that big list that I just gave you, you can use needles or cups or moxa or massage or exercise. Naturopathic medicine, the same thing. You can use, because acupuncture was part of naturopathic medicine, you could use all of those once again because we still got taught the same things. But naturopathic medicine also has homeopathy and nutrition and naturopathic manipulation and herbs. The physical therapy, mostly when I went through school, just had the exercise and the modalities of ultrasound, electrical stimulation, iontophoresis, traction. Now the students are also getting nutrition. So when I look at it, I'm going, hey, these are all the same. I just have to decide which bucket I want to pull from. And usually what I do is I just pull from all of them based on what I think the person needs at that particular moment. If you're afraid of needles, I do non-needle type acupuncture, where I still use the points, I just don't use a needle. Everybody gets exercise because we all need movement. We all need the nutrition. And so you just kind of pick and choose. If I think you need homeopathy, I'll do that. If I think you need some herbs, got to check your medications first, make sure there's no herb-drug interaction, and then kind of proceed with caution in that arena. So supplements come in as an adjunct. You got to be doing the nutrition right first, because there's no point in trying to, what are you supplementing? So basically it's just, I just blend them all together. I never look at it and go, oh, what do I want to do over here from acupuncture? What do I want to do from physical therapy? As I'm thinking about it and as you're talking to me, it's really literally just coming to me. I want to use this. I want to use this. I want to use this. Um, Part of that comes from the training that we got in naturopathic medicine of how to do what we call a workup on a patient when they come in. You come in, before you come in, I get your medical records. I check all of your history. I check your medications. What are the treatment you've done? What's worked? What hasn't? What are you currently doing? Is that working? You take that and then you take the symptoms and you do what you call a differential diagnosis. What other diseases, conditions, syndromes, illnesses have these same symptoms in them? That's one of the things that makes conventional medicine so challenging, is because everything looks like everything else.
Mhm.
You think about, for an example, you think about COVID, the flu, um,
Yeah.
and just a normal cold. They have a lot of symptoms that cross over, and you don't know which is which until you start asking questions and you start ruling in things or ruling out things. So you look at all of that, and then when we did our workup, the last thing that we did was look at all the modalities that we were being taught, and if we were to use each one of those modalities, what would we do? So that we had a plan of action before you ever came in. So I used that same approach. I didn't throw that away. I thought that was really nice. I just like, this is really good, because we only had 45 minutes with a patient when they came in. And that's to talk to you, go back and talk to our attending physician, come up with a treatment plan, come back in, treat you, and get you out of there in 45 minutes. So I just basically just continued to just do that.
And do you feel like, I mean, I'm going to say this. I feel like with your comprehensive training and professional filter coming to you, I would probably feel more served than if I went to just one piece of all of these practices, right? Because like you're taking into so many factors and considerations of the health and well-being of the person that I believe that what someone's going to get from you is going to serve them better. It's going to be more healing. That's it's going to put them on a better path to healing, if that makes sense.
It's as comprehensive. And I guess I never even looked at it that way. It was just, I just blended what I knew. And I had always decided that before even I went to medical school, that no matter what, I was going to use everything that I learned. Because we have a tendency to just kind of pick and choose the things that we like. It all works. The herbs work, the homeopathy works, the acupuncture works, the nutrition works, the exercise works, the manipulation works. All of it works and all of it has its place. It's kind of like you look at conventional medicine. It has its place. The holistic side of the house, it has its place. Now, if I'm in a car accident, I want an orthopedic surgeon. I don't want to take herbs. I want to be put back together first. Then you can bring the holistic stuff in to help me get back together and get my body back in homeostasis and heal properly. You can do that, but there's a place for all of it, not one over the other. And in some places, if you have a trauma, then the trauma stuff is going to work a whole lot better first. Then you bring the other stuff in, and that's why it's complementary. And I don't look at it as alternative. It's just it's complementary to what you're already doing. Let me help you medically manage these people by doing what I do well, while you do what you do well. That's it.
I love the way you just framed that because it doesn't separate. It is complementary. And although you have really, I'm going to say, brought in the collaboration of naturopathic and conventional medicine, I have always felt like conventional medicine deals with the symptoms and we don't really get to the root cause of what's causing what's going on. Like you say, you go in and you say you have this symptoms and there's so many ailments that symptom could represent. You may go in and in 2 minutes get a prescription and you're out the door and You get home and in 5 days, you're still battling whatever it was because the root cause has not really been identified. Do you feel like with naturopathic medicine, with acupuncture, with your PT skills, that you're able to really chunk down the reason why someone is experiencing pain, nausea, discomfort, why they're out of balance?
In defense of the conventional doctors, their model is not the naturopathic model. It's not the holistic model that people sometimes want when they go to them. If you want the natural stuff, then you have to find yourself a naturopathic doctor or somebody who's on the holistic side, or maybe a functional medicine doctor, somebody who's on that side who does that. The conventional doctors have been trained in their medicine. That's what they do. That's their standard of care. The first 2 years of naturopathic medicine is identical to the first 2 years of conventional medicine. All the ologies, endocrinology, and the gastroenterologies, all the ologies. Basically, it's looking at the body, and this is how it's supposed to work. That's what they get. Like I said, the second 2 years, that's when all the holistic stuff comes in for me. Like I said, in their defense, they're doing what they were trained to do. I don't know if they were trained to look for the root cause. They may not have been. And if they weren't, they're not going to.
Right.
They're not going to. They're doing what they were trained to do. And usually they don't have enough time to sit there and talk with you for an hour, like most of the naturopathic doctors do. Some of us take an hour, some do an hour and a half, some do 2 hours. So if you got time to sit there and talk with a person, you can drill down and get to the root cause. So, and you're still going to address the symptoms, because if you come in and you just busted up your big toe and it's hurting, that's what you want treated. Even though your blood pressure might be, 180 over 95. I'm more concerned about the high blood pressure. But if I don't treat your toe, you probably won't come back because you'll think I didn't listen to you. So what I have to do is treat your toe and also educate you on your blood pressure at the same time. I have to do both of those. And I can also, let you know that this needs to be addressed before it gets out of hand, and let you know all the bad stuff that could be coming down the pike if you don't do it. But I'm going to take care of your toe today. But I want you to come back in so we can talk about this blood pressure thing. And so you can do both. And you just have to be paying, I think, be paying attention, or you just look at the way you were trained to do it. That's all. I don't think they were trained to do that. And so it's not what they do.
Right. Now, acupuncture has been recognized for its potential benefits in managing cancer, breast cancer. Can you take a few moments to just explain acupuncture and its process and how it does heal or balance out the system?
Acupuncture is going to stimulate points on the body. We call them acupoints. These points are on the body, and they're not points. They're areas on the body. If you were to take a look at a muscle chart, and muscles are in bundles. They're bundled together, and then there's a sheet of fascia over them. And usually right where they're coming together, there's a little space. And that's usually where the acupuncture points fall. And so basically you're taking a needle to place in that point, and you're going to stimulate the nervous system to basically start the healing process. People get caught up in the energy and the chi. That's what the Chinese call it. It flows along these meridians. If you think about your body, because chi, it's like one of those, what is chi? Everybody's trying to figure out what's chi. I just look at it, what's flowing in the body? We got oxygen, we got blood. Now, blood can stagnate. It can block stuff when you get a muscle spasm. Blood's not circulating. So if I can use some points either locally in that area or at a distance from that area to get that blood moving again, that blood starts moving again. The blood carries oxygen. Oxygen brings in nutrients to help the body heal, but it also takes out waste products. so that they can get expelled from the body. So you're basically, the needle is just a tool. It would be the same if I did ultrasound. Ultrasound is going to create heat. E-stim is going to use electrical current. Your chiropractors are going to do manipulation. They're going to adjust the bones. You go to a nutritionist, they're going to use food. So we all have a different tool. And what we're trying to do is stimulate the body to get back into homeostasis. The body wants to be balanced. That's what it's trying to do. When you start to get these symptoms, your body is really sending you a message that, hey, I'm having a hard time getting back into balance. You get enough symptoms, and eventually you go to the doctor, and now those symptoms add up to a condition, a disease process, an illness of some sort. So so they're going to treat that, the conventional doctors, with what their medicine is, pharmaceuticals. We got a list of drugs that we can use. If you come to me, you might get exercise, you might get acupuncture, you might get nutrition. I'll talk to you about all of it. But it's ultimately your choice as to which recommendations you're going to take and to implement.
I'm going to ask you to put your naturopathic physician hat on and identify 3 herbs that you feel would be, a go-to 3 for breast cancer survivors, and the reasons why you would suggest these herbs.
Mm-hmm. I usually try to stay away from these kind of questions. 3 herbs. There are a lot of them. Okay, I'm gonna give some. I'm gonna give some that aren't as controversial. Let me give 3. Turmeric, curcuma longa. It contains curcumin. It's an anti-inflammatory. It's also an antioxidant. And research shows that it can decrease or reduce the inflammation in your body. Because as a breast cancer survivor, you're still going to have some inflammation in your body after all the treatment. That's what I would do. The curcumin, it will help the liver to detox. A lot of the chemotherapy, that's basically poison. It'll help the liver detox some of those toxins and get them out of your body. That's one. Ashwagandha. It's an adaptogenic herb. And what it does is it helps your body manage stress. As a breast cancer survivor, you're going to have physical stress from either, if you've had surgery, from the incision site, all the healing that takes place there, or it could be emotional, because when you get the diagnosis, there's fear and there's anxiety, and usually nobody addresses that at all. And the body can't heal if it's stressed out. So if you want to, so with ashwagandha, it will also, since it is an adaptogenic herb and helps to manage stress, it'll help to try to reduce some of the fatigue. It can help with reducing some of the anxiety. It can assist with balancing your cortisol levels, which is your stress hormone. And that's going to be basically crucial even after you get some of the treatments that you have. Ashwagandha also has anti-inflammatory properties as well. The third herb, ginger. Chemotherapy, a lot of nausea. Ginger can help reduce nausea. If you've undergone, just nausea, whether you've undergone the chemotherapy or just nausea in general. It also has anti-inflammatory properties. It can help manage pain, and it'll help your body recover. If you have digestive issues, it'll help with that as well. The gas and the bloating, it'll help with that, which are sometimes side effects of some of the cancer treatments. It has an antioxidant effect as well, which will help to protect the cells in the body from oxidative stress. So those are 3 that I don't think you can get in too much trouble with. Still, once again, If you're on medication, take a look at the medication, check to see if there are herb drug interactions. Because if there are, you don't want to take it. You want to find something different. And there are enough herbs out there that you can go to. But those are three like simple ones, I think.
I think you make a strong point and an excellent point about the interactions between herbs and medications, because I don't think, just the average person thinks about an herb as having the ability to interact with their drug or have some adverse effect on them and their health.
Mm-hmm. Mm-hmm. Yep. I don't think we look at it because I think we're just trying to get healthy and we're just trying to do better for ourselves. Um, and I don't think if no one tells you that you need to do that, you don't think about it at all. And if you get a side effect or some negative response from it, you don't even know that it's the herb. You might think it's something else.
That is something that I think is very crucial for breast cancer patients, survivors, and that's really educating ourselves. A lot of
Mm-hmm.
times we're given information and we just take it and we run with it, but diving in, doing some research, understanding a little bit better about what's actually going on and what we're putting into our body would probably help us tremendously.
And the thing you have to realize is that there are some drugs, some medications. We stop calling them drugs. That sounds like a bad thing. Some of the medications come from herbs. Your morphine comes from the poppy plant. Aspirin comes from white boulevard. What is another one? Digoxin for heart stuff. That comes from foxglove. So some of these medications you take, they originated from herbs. So it's not all terrible, and most people don't even know that. But some of them do. So yes, I mean it's do your homework. That's the biggest thing. Do your homework. Don't listen to everybody because there's a lot of information out there. There's a lot of information out there. I can get confused if I go out there, but it's like, what specifically am I trying to address? And I can look at all the different ways that I can address that. And what way is not going is not that it's going to harm me the least, but what way is not going to harm me? And if I'm in doubt, don't do it. Don't do it. You can talk. Naturopathic doctors are licensed in 26 states, the District of Columbia, and the Virgin Islands, and 6 provinces in Canada. So we're around. Now, in the state that I'm in, they don't recognize naturopathic licensure. But it doesn't mean I can't use the education, because the acupuncture and the physical therapy allow me to still just like I said, they all have nutrition and exercise. So there's all, because of the overlap, I can still use the things that I've learned. Even with the acupuncture, like I said, I don't have to use a needle to stimulate that point. There are other ways to do that for people who are needle phobic, and there are other ways to do it.
Dr. Thrasher, if there is one last bit of information that you could share with breast cancer survivors here at the Breast Cancer Wellness Summit, what would it be in order to inspire, encourage, or just to educate?
Take your health into your own hands. Stop depending on the system to get you healthy. No medication is going to get you healthy. No medication is going to improve your health. It will help to manage the symptoms. Do your due diligence before you take something that you heard about or that you saw on the internet. There's a lot of information out there, and it could be valid, but do your own due diligence. I will go search the research. If you're wondering about something, type in the name of it and put PubMed behind it. And if there's any research on it, it'll pop up. Now, it may blow your hair back because you'll be like, oh my gosh, there's so much of it. Just look at the titles, find the title that you can kind of, okay, I understand that. Let me click on that. A review article will sometimes take a lot of the scientific research that's out there and put it all in one article and kind of summarize it for you. But you can do that. But I would do my own due diligence. I would take my health into my own hands. Natural healing is slow. That's the other thing people don't realize. They want to do it naturally, but they want to do it fast. It does not work that way. It doesn't. It takes time. If you get anemia, red blood cells take 120 days to go from birth to death. That's 4 months. That's 4 months of diligently doing the nutrition. There's 4 months of, if you're going to take supplements, of diligently doing it and being patient and waiting. You get your labs done first. Oh my gosh, I got anemia. What do I do? If I'm going to supplement, okay, yeah, you can supplement and get everything in the blood, because that's what the labs are looking at. The results are showing you what's going on in the blood, and the body will do whatever it needs to balance out the levels of all of those different hormones, proteins, and things in the blood. And you look at it and you go, okay, I'm going to give myself a year to get this all back together here. I'm going to get my health back. Take your time, and you can make small changes in exercise, make small changes in nutrition, make small changes in mindset, make small changes in your sleep hygiene, make small changes in your movement or exercise. So you just do each one of these just a little bit at a time and give yourself enough time to get there. I don't know why we're in such a big hurry. Give yourself time to get there, because you're going to make mistakes. You're going to start in a blaze, and life's going to happen, and you're going to get off track, or you're going to stop, or you're going to halt, or you're going to slow down. And then you'll realize, oh, I need to get back on here and start doing this again. I cycle my supplements. I'll do them, and then when I run out, sometimes I'll wait 2 or 3 weeks before I start them up again. Just because. And I don't have any real reason other than I just want to wait. Let me give my body a break, tired of swallowing pills, and then start it back up. Because it also gives you a chance to think. If you like to journal. Get the stuff out of your head, because we live a lot up here. Stress is supposed to happen to us. We're supposed to handle it, and then we're supposed to move on. It's not supposed to just continue for hours and weeks, and it's not supposed to do that. So take your health into your own hand is probably the big thing, and do your due diligence on whatever it is that you are about to add to, modify, change, implement into your own routine.
Thank you, Dr. Thrasher. Your time here has been invaluable. And I don't even know what else to say, because it's been so comprehensive. It's been so inspiring. It's been so educating that I just want to say thank you.
You're welcome. Thanks for having me.